Hi, and welcome to Express Care, a LifeBridge health partner. And I want to turn my attention over here to Katie Previs, a doctor's assistant, I guess, what you are. But more importantly, you're kind of oversee the company.
Sure, I'm the Chief Operating Officer here at Express Care.
And when I talk about that, because it's very important that people, because you see different clinics and things around, but what is let's talk about what a clinic is first of all, because if I'm in a life-threatening situation, this is not where I want to be.
So certainly here at Express Care, we treat all non-life-threatening conditions, but our providers here are skilled enough to tease out what's life-threatening or not. So if you come in and we can't see you here, we will certainly give you a great screening exam and help you get to the elevated care in the ER that you need. We see non-life-threatening conditions such as cough, cold. We can do sutures, we can splint, we have x-rays, laboratory evaluation on site. You can even get your prescription medications filled here all in one visit.
Yeah, but it's very important because I want to get them, because I think these are fantastic, because there's nothing worse. I was talking to you guys earlier and talking about picking up the phone and calling my doctor and saying, hey, I need, I'm not feeling good, I need it, and I know it's not urgent, it's not life-threatening, I should say. It's always urgent when you're not feeling good. So, but I know it's not a life-threatening situation, but I want to see a doctor, and I want to see a doctor today where they might tell me, well, she's booked up for the next 3 or 4 days. By then I might be feeling fantastic. I don't need to see, but that's one of the things that you could use you guys for.
Absolutely. So at Express Care, we know that, when you're not feeling good, it is urgent. And so we do urgent care here. We feel that we do it right. You can make a reservation online.
I love that. Versus an appointment, and it feels, because that's what you got, is a reservation to come in, and what that does, and I love your system. We're going to show your system here in just a little bit, because it's phenomenal what you're able to do, because you can make a reservation online, or you can walk through the door. Don't hesitate to walk through.
To walk right through. And the good thing about the reservation system is you can make it from the comfort of your home or even on your phone, just through our website, which is whywaitintheer.com. You can go on there, and no matter what state you're in, Maryland, Delaware, Pennsylvania, you can find a clinic that's closest to you. You can pick the time that's most convenient for you. If you don't want to be seen right then, you can choose a time that's after work or after baseball practice or whatever. And then we'll actually alert you as to if we get busy in the meantime and that's going to be pushed out 20 minutes, we'll let you know that before you have to come in and wait. You can wait in the comfort of your home and come in when it's your time to be seen, and we'll get you all the way through.
Yeah, I know when you look at that, because you can go, when you go to the site, it kind of shows you, hey, this is a busy time of the day right now.
Absolutely.
So you might not want to come right there. You might want to delay it an hour or something.
Absolutely.
But and walking in, that's what I like about walking in too, because you have a screen in all your facilities. As soon as you walk in, you can look up there and see who's here and and how long is it going to be.
Absolutely. You can monitor your spot in line as you come in, and we certainly take the online reservations and walk-in patients, just everyone equally is serious. We get them treated to the best quality care that we can.
And when you say the best quality care, folks, this is what I want to talk about a little bit, because when I'm talking about Express Care, you're building that, I love that LifeBridge partnership for healthcare, and that's what you guys become. You're kind of a bridge in between your regular doctors, the hospital, whatever the case might be. But it's important. I want to be sure that where I'm going, that it's the right people I'm going to see. And I want folks to know that you guys, you're the main people for the Baltimore Orioles. I mean, and you're associated with hospitals over in Baltimore as well?
Absolutely. We have a partnership with LifeBridge Health, which gives us access to some of the region's top orthopedic, any specialty. We help patients find referrals into their networks. We are the official urgent care of the Baltimore Orioles. So we, have a lot to do, a lot of community involvement in our clinic. Our patients are very important to us, and make sure that they get from start to finish to even after the follow-up care that we don't specialize in, that they get the best care that they deserve.
Right, and so a lot of times, I'm glad you hit on that, because that's something I never even thought about. Sometimes you need to, and especially with the insurance, because you guys accept a lot of the major insurance, and with the insurance, sometimes to see a specialist, you have to go through a primary doctor to get referred to that specialist. So you guys can do that for me.
So we can offer the names and point you in the right direction. Depending depending on your insurance plan, sometimes you do have to, you know, consult with your primary care physician. We don't do primary care on site, so we are strictly episodic care. So, you know, whatever the acute problem is at the time. But we will do our best to point you in the right direction and make sure you get all the information you need, or get you back to a primary care physician if you don't have a primary care physician.
Because that's what I was going to say. A lot of people don't have those.
Absolutely.
Yeah.
So we can help find you one, and we can follow you up in the meantime.
Because there's nothing worse. I've experienced that. My wife moved here with her kids, and we're going to talk about kids too. This is very important. But when she moved here with her kids, we needed to find a physician. And, you know, I had mine, but they're not taking any new patients, you know. And so you run into that, but you guys will assist the people that need that primary care?
Sure. So if someone were to come into our clinic for no matter what the reason, an earache, you know, a baby has a fever, whatever it is, we see all ages, you know, 0 to however old. We will take care of you and then, like I said, point you in the right direction. And you can always return to us for any of those episodic visits you need. If it's a fever one day, you slipped on the ice the next day, or you know, slammed your finger in the car door, we can take care of all those types of injuries.
And those are great, because there's nothing worse. And I've experienced, and I'm sure you have before, sometime in your life where you had to go to the emergency room. There's nothing worse than going in the emergency room and you need something, you want care right now. Well, in an emergency room, they do it completely different. You might sit there. I've witnessed people sitting for 2 to 3 hours before they can even get back to a doctor. You know, so, and that's the last thing I want here. That's not going to, you know, it's the way you guys got it set up. It moves pretty smoothly.
Yes, we try to get everyone in and out as efficiently as possible. We have many systems in place to ensure that patients are taken care of quickly and that they don't experience those long wait times.
Yeah, and what I love about it, because we came in here and there was 3 people on the board, and they're all gone except for the one that registered online, and they're going to be here in a few minutes.
That's
so
right.
it moves that rapidly. You know,
That's right.
sometimes busier than others. So, but you can monitor what's happening. Like, I love the fact that you guys will notify me back if I made it online and came in and get ready to come in, saying, hey, wait a minute, it's backed up a little bit. You might want to wait another 20 minutes.
Yeah, we give really, you know, a complete care package where we will allow you to make that reservation online. You come in, we'll take good care of you, and we'll even call you the next day to make sure you're still feeling well and make sure that the medication's going okay, and offer you again any of those referrals to the specialists that you need. And we're available for all your questions. You know, we really take it seriously that you are feeling better.
Here's a great scenario for you. It's the weekend. Find my doctor on the weekend, find any doctor on the weekend. You guys are open 7 days a week.
Yes,
so,
7 days a week, 8 a.m. to 9 p.m. every day.
So if you're out there, you know, and it's a weekend, you're out there doing activities. Most people get hurt on the week, break a bone or whatever.
Right, pulling a muscle.
Right, you guys are here, and then you come walk in. Once again, go online. You know, there's a lot of different ways, and we're going to talk about that here in just a second, because I love the system you guys set up. But I want to talk about, if I could, about Bear, Delaware, and what you got going on here at this facility that we're standing in right now in Bear, Delaware. You've got a great program to introduce yourself to the public out there. You guys are here and offering great things for the folks out there, especially back to school kids. That's what I want to talk about.
Absolutely, yep.
Yeah.
We have a special going on right now for all the back to school physicals, camp physicals, sports. You know, teams always need that papers updated before they get back on the field, and we are offering to all of our patients $15 sports physicals just at our Bear, Delaware location.
Flat right now,
flat
it's
rate.
going on, coming in, you know, it's flat rate. You got $15. So I know kids, when you're going back to school or transferring to another school, sports activities of any kind, you got to have those.
Right.
And right now is your opportunity to get it, and it's only at the Bear location. And this location, once again, the address is on the bottom of the screen here. Just, you know, come out and visit it, go online, schedule an appointment. You're not going to find them anywhere in town till you get the physical for $15. Now,
right.
Another thing going on at Bear, we want to tell everybody about, anybody that coming in and they want to, for whatever reason, it doesn't have to be a kid or whatever, first aid kits available.
Yep.
All you got to do is be sure to tell them you saw it on TV.
That's right. Just let us know you saw our program today, and we will give you a free medical kit, a first aid kit. It's really great. You keep it in your car. You can keep it, you know, in your backpack. Anything. It's got some, you know, bandages, common first aid needs, which it's been really popular in our other clinics as well.
Right, there's nothing worse than trying to find a Band-Aid when you need it, so you want to be able to have that. But anybody that comes in, if you just go up to the, you know, when you're here and let them know, hey, I saw this show on TV and I want to get my first aid, and we're going to give that to you, no problem whatsoever. And the kids, once again, remind you, your kids got physicals to do. It's that time of the year, $15 flat rate, so you don't have to worry
in
about
and
it.
out. We'll get you in and out.
Yeah, that's what's really nice about it. Now, I would like to also, you know, because I'm looking at this facility here. I mean, this is your standard facility for all your locations?
Standard, yeah. We have 27 locations in Maryland, Delaware, and Pennsylvania. We really want patients to come in and feel comfortable, feel like they're in a place that makes them feel better and taken care of. So this is our standard, you know, facility. And if you come to one Express Care, you'll be treated the same in one center as you are in any of the other 27 centers. So we really pride ourselves on the health care that patients deserve.
And I can tell, just meeting and talking to you, that's very important to you.
It's very important to us.
And so you guys are constantly visiting the centers. You're out on the road, you're talking, you know, you guys, so you're going to all the different centers, being sure that they're providing the services that you guys outlined how you want this thing to run.
Yes.
And, you know, so it's very important to
We
run
work
it that
very
way.
closely, the entire management team works very closely with the staff to make sure that the centers are run, you know, very efficiently in a certain way to give that optimum level of care.
Yeah, it's all here for you. Once again, this is Express Care, a LifeBridge
Health Partner.
LifeBridge Health Partner. I want to talk about this patient check-in, so let's go over here and take a look at this. It's important that you know what to do when you walk in or have a reservation here at Express Care, because you guys have this system in all your facilities. I just fell in love with it when I saw it, you know, because there's nothing worse than, you know, the nurses behind the counter and stuff. They're always so busy doing so many things.
Right.
Here you guys make it real easy.
Right, so we have our Express Pass system, which you can access from our website. And when you come into the clinic, it'll ask you whether you're a walk-in patient, so we accept, you know, walk-ins all day long, or if you signed in online. And if you had pre-reserved your time online, then you would just come in, hit the online button, and then your name will be already on the screen, and you just let us know that you're here. And then our front desk crew will get you all signed in from there. If you're walking in, it'll ask you for your name and phone number, and then the front desk will let you, you know, get your paperwork going from there as well. It really speeds up the process.
Yeah, so I come in, I hit that, and I go over and take a seat, and they'll call me up.
Absolutely right.
The front desk will take care of any paperwork and all that stuff.
Absolutely right.
Then I go back and have another seat, and then somebody from the back comes out.
Yep, all you have to do is bring your, you know, yourself and your ID and insurance information with you.
Right, right. And I want to talk about that because you accept all major insurances and stuff like that. But I also want to talk about, if we can, what if I don't have insurance?
Absolutely. So if you don't have insurance, we have a really a reduced self-pay rate. So simply you come in, tell us what you need, what kind of care that you need, and we have a kind of flat rate, reduced fees for self-pay patients.
Yeah, well, that helps, because there's a lot of people out there, God bless them, that you know need that, and you know, to have that available to them. They need to know. Also, if we could, before we get back into, because we're going to go back and visit labs, you know, it's a full service facility when we talk about Express Care. But you also, I want to push out workers' comp and auto claims, and that you guys.
Sure, we see everything. So workman's comp, if you're injured on the job, you can come in and be seen. We have x-rays on site, sutures. All you need to bring is you know, your employer's information, and we can verify the service over the phone with your employer and get you treated really quickly. Same with auto injuries. Come on in. And we can go through those insurances as well.
And then point them in the right direction for the care, whatever care that might be, that you guys might not be able to handle from there. And but I'm telling you what, if you're a company out there, what a good number to have in your pocket, you know, when it comes to, you know, because you never know. I mean, workers' comp is workers' comp.
We never know. We also have many partnerships in the community with companies that send their employers for occupational health services all the time. So that is another area that we can service. And those employers can, if it's routine services like so drug screens,
I was going to say blood work,
or injury services, those employers can use the same online system to plug their patients in and reduce the time that they're away from the job.
Yeah, so it's great for you. If you're a company out there, be sure and put that number. It's on the bottom of the screen in your someplace in your office, in your pocket. So if you have something going on, I love the fact that drug screening and all that makes it a lot easier versus going to send them to labs and all that. And
Yes,
it's
we
all
can
here.
take care of it.
Yeah, it's all here and available for you. Express Care. We got so much more we want to show you, but I want to introduce them to some more staff. I want to thank you so
Great.
much, Ms. Katie,
Thanks.
for explaining some of the things that go on here.
Absolutely.
And hopefully we'll see you before it's all said and done.
All
Not for a
right.
patient, just to
That's
see you.
right,
All right,
that's
stay
right.
with us. Now I want to come back into where it all really takes place, and I want to introduce you first of all to Eric Davison. Is that correct?
Correct.
You know, your title is, I always forget it,
That's okay. It's the Director of Mid-Level Providers.
and which is, you know, you oversee a lot of things.
I oversee our mid-level providers, which are the PAs and the NPs,
Yeah.
physician assistant and nurse practitioner.
Right, right. So there again, you're in all the facilities, and just to give you, your kudos. I mean, you spent 12 years in an emergency room, so it doesn't get any better than for what you guys are trying to do here. You've seen it all.
Correct.
Yeah, and what I love about coming into Express Care, and I want to be sure I get that a LifeBridge health partner. When you come in here, is the facilities are absolutely gorgeous. That's first of all. But
Thank you.
now you get checked in, you do all that, and you come into the back, and you have individual, patient rooms.
Yes.
Yeah.
Most of our centers have 8 to 9 patient rooms, each equipped with beds and the otoscopes, ophthalmoscopes, things we would need to see most patients.
Yeah, so the doctor has everything that you go in there. I mean, they can check your ears, your eyes, your throat, all that right there in
Everything,
the room.
yes.
And what I like about it, now I need some blood work, and you guys have that available that you can do that right here on site.
Exactly. Blood work would be drawn in a patient's room and then sent respondently to the lab work.
Right, and get all that done. So, the nice thing is you guys are able to analyze a lot of things within, once again, just coming from an emergency room, would you say, I would say this is faster than what an emergency room could ever do for
Yeah,
you.
well, absolutely. It is faster. It's meant by design to be faster, just strictly for efficiency,
right.
to get patients in and out, in a comfortable time frame.
Yeah, now I've been to the emergency room in the hospital, and I've broken bones and all that, and now I got to be put on a gurney and wheeled down to the x-ray room and all that. You guys have it, I mean, how convenient is this? I mean, because you can do this on all your facilities.
Correct.
X-rays, any type of x-rays that they need.
All of our facilities have an X-ray in-house, located right adjacent to the patient room, so it's just a short trip.
Right, and then you come over here, and I guess most common broken legs, fingers, arms.
Yeah, well, we do X-rays on a wide range of things, spine X-rays on a lot of car accidents, twisted ankles, chest X-rays for coughs, that type of stuff.
Well, I never thought about that. Yeah, when you
Yeah.
talk about lung X-rays and things like that, I guess you guys can do that. The chest X-rays.
Yeah,
right?
absolutely. We have to be able to evaluate for pneumonia and other chest-type pathology.
Yeah, so it's a full service, and that's what's nice about it. It's an emergency room where you don't have to go through all the stuff that you have to go through in an emergency room.
Correct.
And you faced it. You're on the backside of it. I understand those folks and the situation they have. You got to look at it as, okay, what's the most critical? If I'm sitting there and I got a busted leg, and you got somebody came in here with 20 gunshot wounds, they're going to take him before I go with the busted leg.
Correct. Yeah, the triage process is more or less the same as it would be in the ER. But luckily, we don't have as emergent patients as the ER.
Right, right.
naturally.
So most of your patients are the type that can come right in, and
Right.
love the way they can get registered and come in, check in and all that, reservations, and then you come back to the doctor, back in this room. But one of the rooms that I love, because I got a chance to go in there, and I got a chance to play in there and draw on the chalkboard and all that, your children's room. I mean, you guys thought of everything that you need, because a kid comes in, and trying to occupy them. In some cases, coming in, maybe the mother's got one child that's getting treated and got the other child with them, and
And trying to occupy them, right? Yeah, we try and make the patients feel as comfortable as we possibly can, trying to create a home-like atmosphere, give them something to do to preoccupy their time. We understand that they're not feeling well, and nobody has the patience that they always would when they're not feeling well. So we try and make it as easy as possible for them.
Yeah, and another thing now, I come in here, okay, you've analyzed and I've know what my problems is, be it, I need a cast, you guys do all that, so you do all that. But now I need a prescription, so you're going to write me a prescription. Now I got to go turn that into the drugstore and wait on. That's not the case here.
No, sir, no. All of our 27 locations have an in-house formulary. It's comprehensive in terms of what we would ordinarily write out of urgent care. We carry antibiotics, various antibiotics, some pain medications, muscle relaxers.
It's nice to have an in-house pharmacy with right here to.
Absolutely.
So you're one stop, because I ain't feeling good. The last thing I want to do is go down and
make another stop.
And make another stop. I want to take my medicine. I want to go home. I want to take my antibiotics or whatever the case might be and relax and get to feeling better.
Absolutely.
Yeah. So it's all one stop for you. It just doesn't get any better. I mean, with what you guys have to offer.
Well, thank you. Yeah, we've really tried to streamline the process, and it's a fluid situation. We're constantly evaluating our services and how we can improve them for the patient experience.
Yeah, so once again, we showed you how to check in, how to do it all. It's actually Express Care. So visit the closest Express Care to you for all your needs, except for life-threatening. And and if somebody's there and you see that, you're going to get them to the situation where they need to go.
Correct.
Yeah.
Most of like myself, most of our staff, physician and mid-level staff, has ER, emergency medicine type experience. So we're able to confidently triage who belongs in the ER and who we are capable of treating here.
Yeah, treat them here and send them home. That's
exactly right.
Yeah, that's what I'd like to do. I don't like any, another one. It's all here for you once again, Express Care. But I've got something else I want to talk to you about, especially if you're in this field and looking for a job.
Yes. So Express Care is growing rapidly. We're the fastest growing urgent care in the Mid-Atlantic region. And as such, we're currently holding interviews for all positions, physicians, physician assistants, nurse practitioners, clinical staff, including medical assistants and x-ray technicians, as well as our front desk receptionists. We're interviewing and actively hiring for all positions.
Yeah. Now, how did somebody go? Now, because I always wondered that. Now you got doctors. A doctor. What's the what I have to do to say pick up the phone and call you guys? I mean,
so you can go to our website www.whywaitinER.com, and on there there's a spot you click for online application.
All right, so I just fill that out, and then you guys will contact me.
And that goes to our human resources department. We'll be in contact.
Yeah, so doctors, nurses, your
mid-level providers, physician assistants, and nurse practitioners.
X-ray technicians.
X-ray technicians, medical assistants, and the front desk receptionists.
Yeah, so maybe a lot of job opportunities.
A lot of job opportunities. Yes.
Yeah, and they're looking for them. So if you're I guess people that's got the background in, like you guys, you want those, but somebody just graduated and getting out. I mean, because I'm sure you got some training programs to work them through.
Absolutely. It's funny that you just brought that up. We've just recently introduced a training program for new graduates. Our growth has been that we've had to expand in terms of the population that we would hire. We ordinarily would look for people with experience, but given our growth, we've had to expand that to include staff, including new grads. And so we've now implemented a training, almost like a residency type program, to help people get up to speed.
Right, which is fantastic, because this is going to, if it doesn't, as well as I do, it doesn't get any better for training than being in an ER situation.
Correct.
And with what you have here, you're pretty much in that ER situation.
Yeah, yes, we are. To a lesser acuity, but yes, absolutely. It's the same. Walking, you never know what's going to walk in the door. You treat a wide range of pathologies here. So yes, it's very similar to the ER.
Yeah. So for more information, get online, check that out, and I'm sure that Eric or one of the folks will contact you, get you in for an interview, chit chat with you about that. So if you're looking for a career in this, and if you have none of that experience, maybe front desk might be your deal. So
absolutely.
Yeah. So anything and everything is available for you right now. If you're looking for some employment, check out Express Care, a LifeBridge health partner for you. Eric, thank you so much.
My pleasure. Thank you.
A LifeBridge healthcare partner, that's what you're going to find at Express Care. Thank you so much for tuning in today for all your healthcare needs. You definitely want to check this out. Wait in the ER no more. You can come right here, go online, whywaitinER.com. You can find out more about it. Remember, the hours of operation 7 days a week, 8 to 9 o'clock. It's all here for you. It's Express Care, folks. It doesn't get any better. Got some great people inside. They'll take care of all your needs. Until next time, for the entire staff, thanks for watching.